how we usually do the diagnosis of hypothyroidism. It talks about three main topics. The first, and I think the most important, is the medical and family history of having hypothyroidism. Medical history and symptoms are quite important, as we were talking about before. And we have two blood tests that are the most important. One of those is the measure of TSH, and the other one is the measure of T4. TSH means thyroid stimulating hormone. This is the most important and the most sensitive test for hypothyroidism. TSH measures how much of the thyroid hormone or T4 the thyroid gland is being asked to make. So it is quite important. Um, it is important to know that TSH levels are inversely proportional. So if you have abnormally high TSH, it means you have hypothyroidism. It means that the thyroid gland is being asked to make more T4 because there isn't enough T4 in the blood. It is important you to understand that.
Yes, that's something that some patients, when they receive their test, they're not able to interpret the test. Okay, so yes, it's basically the opposite. If you have a high TSH, you have hypothyroidism, and if you have a low TSH, that means you have a hyperthyroidism. It's a little difficult to understand, but that's the way it is. And of course, the ultrasound is very, very, very important because it let us know whether this condition that you have is something with that's that might be either malignant, which is very, very rare, but we can see it, and also if you have nodules or something in the thyroid that might be overacting or underacting. So it is basically blood tests and ultrasounds are the most commonly used. And of course, yeah, here use your TSH and the T4. That's basically what your doctor will order.